Hello, today is Saturday, April 16th, 2020. My name is Brittany Garcia. I am interviewing Raquel Alonzo for the University Library Special Collections and Archives at the University of Texas Rio Grande Valley. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Raquel, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs and other documentation you are willing to share. UTRGV University Library will retain copyright or non-exclusive right to the interview and any other materials you donate to Special Collections and Archives at UTRGV. Because we are not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions. Please say, yes, I agree, or no, I do not agree after each question. Question number 1, do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes, I agree.
Number 2, do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes, I agree.
Question number 3, do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voices of Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes, I agree.
Okay, thank you. As you recall, we previously filled out a pre-interview form. We use information from this pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it UTRGV University Library Special Collections and Archives, we would have stripped out any contact information for yourself or family members. So that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Question number 5, do you wish for us to share the rest of your interview in your public file available to researchers at UTRGV University Library Special Collections and Archives?
I agree.
Next question. On occasion, UTRGV Special Collections and Archives and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent to us to share your phone numbers or email with journalists?
Yes, I agree.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you say in interview questions I will now ask. Raquel, thank you for your time. Like I said earlier, your stories and experiences are valuable to us at UTRGV Special Collections and Archives and to our partners at the Voces Oral History Center at the University of Texas at Austin. Because you are a parent educator at Easter Seals, as well as a full-time student in the Masters of Education in Early Childhood program at UTRGV, and were living with your family during the pandemic outbreak, I know you have many meaningful stories and experiences to share on how COVID-19 has impacted these roles you carry out in your life. So before we talk about COVID-19 stories, can you please share with us a bit about yourself? Who are you and how do you wish to be known? Who is Raquel Alonzo?
Starting with a hard question, just kidding. I am a single woman. I'm almost 30. I live in the RGV, and I am soon to graduate with my master's in early childhood education program.
Very
And
exciting.
yes, and I have a cat that I love named Ruth, but those are just a couple of things about life right now.
Okay, great. Um, so the first section of questions asks you to please share your stories and memories from when the COVID-19 pandemic made its first impact in December 2019 to about the summer of 2020. So the
Mhm.
first question I want to ask you is, can you share some memorable stories about how you first heard or learned about COVID-19? Was it through the radio, TV, children, social media, etc.?
I think it was probably through a coworker. I had a coworker who had started bringing a mask and putting it in her desk, and we thought she was being really outrageous. And then she would show us our, like, news reports of the virus spreading, and before we knew it, it was like, oh, maybe she's onto something here, not knowing that was going to be our future for the next few years.
Right. When was this? When was she starting to bring in her mask?
It was probably February
Oh,
of that year, which was what, 2020?
yes,
Yeah, crazy.
it is. It is. And how fast it came down towards us. So,
Mhm.
question number two, what were some early reports or rumors about COVID-19 that you remember back in 2020?
Hmm. Just, I mean, really, I just remember hearing about how quickly it was spreading, how dangerous it was for high risk populations, people with pre existing conditions. And just, I guess there were a lot of reports of the large amounts of death that's kind of what sticks in my mind.
Right. Yes. I guess that kind of goes on to our next question. At what point did you realize this pandemic was a serious life altering event? Or do you not think it's serious? Why?
No, I do think it's serious. And I'm going to go back in my photo album to remember these days. I had a visitor from out of town during March 15th ish, and they had to travel back home. And the airports were going to shut down. And that's kind of when I was like, oh, wow, like airports are shutting down due to COVID. Maybe this is a lot more serious than I thought.
Yeah. Yes. Um, thank you. So question number four, do you remember what it was like for you during the stay-at-home orders in 2020? Do you have any stories from this time you could tell us?
Um, Now being back to quote unquote regular life in the office, it seems fun. I remember being home and getting TikTok and making breakfast and coffee, and it was almost like a vacation from the real world.
Right. Yes, very much so. Um, so, over the last couple of years, what news media, social media, or other sources do you rely on to keep you informed about COVID-19?
Mm, I can't say I'm one to like be obsessing over the news, but mostly the local news. If I had to say, I would follow the local news for information, and um, city and state social media pages for updates on changes in mandates or um, numbers of reported cases or deaths in our area is
Mhm.
kind of where I would get information from.
Okay. Can you share with me what you understand about COVID-19 as an infectious disease and how you feel it's impacted society? Likewise, can you share with me what you don't understand about COVID and wish you could know more about?
Well, I absolutely don't know a whole lot about the science of COVID or all of the logistics on how it's contracted. I just know that I contracted it. From what I understand, it's very contagious, and now there are multiple strains of it. As far as how it's impacted society, I think there was a lot of fear that that had an impact on society. And I think the large amounts of people who have passed away has an impact on society. The
Right.
way that we had to stop, it seemed almost like our country came to a halt, and a lot of jobs went remote, had to have had an impact on society. Um, the way it almost became politicized, I'm sure, had an impact on society. But yeah, there's plenty I don't know.
Yes. Okay. So the last question in this section is, do you feel your family has the same beliefs as you about COVID-19, or are there some members who take it more seriously or lightly? How so?
Yeah, my family is actually seems to have different beliefs on the matter. Um, in my extended family, we have family who takes it a lot more serious and have been much more sheltered than us. Um, and then there are those who have chosen to not get vaccinated. Um, and then there are those family members that have made it political in a
Mm.
sense to be vaccinated or not vaccinated. Um, and so, yeah, there are definitely some different beliefs in my immediate family and my extended family.
Right. Yes. Okay. Well, thank you so much for answering that section of questions. This next part asks you to share any stories about COVID-19 vaccines and any vaccine related stories you may wish to tell.
Mhm.
So, did you get a vaccine and any follow up booster shots?
I have received the COVID-19 vaccine, but I have not got the booster shot.
Okay. And so, what was it like receiving your vaccine?
Because I have pre-existing conditions, I was able to get on a list to get the vaccine rather early. Like I actually got it in December of 2020,
Uh huh.
right? Yeah. So right before the new year, I remember I actually got it on the same day as the vice president, and I felt very special. um, but yeah, it was not hard or difficult. I didn't have to wait for an enormous amount of time, but yeah, that's what it was like for me.
Okay. So, can you share a memory from the place where you were vaccinated?
Um, I know it was a clinic. It was a health clinic from the university there in Weslaco, I think. It was not stressful or chaotic or anything like that. It just seemed like a normal medical clinic.
Okay. Um, so, the next set of questions are going to ask you about how COVID-19 has impacted your life in the way of your career and your family. So, Raquel, I understand you are very close to your family. So, how has COVID-19 impacted your life in terms of family traditions and relationships? Can you share with me some stories or examples on how you and your family have adapted during the pandemic?
Sure. So, not a whole lot has changed with my immediate family. We've still been able to gather for, birthdays, holidays, but mostly because we live together. But my extended family is who we would spend a lot of holidays with, and I haven't been able to see them really in 2 years at this point for holidays, and that has been really hard. It's very sad.
It
It's
is.
sad because we're all seeming to go with life. Everyone's going to the store and doing their things, but it seems like this was definitely a wedge in us getting together, and it's sad. So a lot of the traditions, like gathering around, I think, the COVID stuff happened in March. We weren't able to get together for Easter then or since, for Mother's Day, for the 4th of July, for Christmas, Thanksgiving. And those are all times where we normally would spend with our extended family, and we haven't. So it's been kind of sad.
Very sad, a very sad outcome from this pandemic, one of the sad outcomes.
Mm.
Um, What discussions did you have, if any, as a family regarding mutual responsibility and safety from the virus?
Here in my household with my parents, we did talk about trying to wear our masks out in public because I mean we all have some sort of risk factor, right? But my dad mostly he has history of cancer. We really didn't want for him to be sick or potentially just cause him any illness that would impact that. So we did decide to just try our best to limit. This was more so at the beginning to wear masks and limit outings with large groups of people.
Okay. So what are some changes that have remained regarding your immediate family or family as a whole as a result of COVID-19? And did any new traditions arise during this time?
No, we're not innovative enough to come up with new traditions. We've just done without. As far as changes, nothing. I mean, kind of just what I mentioned. We
Right.
haven't really gathered with family, extended family, but so things are kind of the same.
Okay. Well, can you share a positive, memorable moment for you that you had with your family during the lockdown?
I mean, I guess like on Thanksgiving, something we just try to do is practice our gratitude and thankfulness for the things we have. And so, even though we weren't able to be with our extended family, going around our table of just us and sharing our gratitude for our health, continued health, and for the health of our loved ones, that's kind of memorable to be able to have thanks for that when there are so many people who have lost loved ones.
Yes. Um, that is a good memory. Um, what is a negative, memorable moment for you that you shared with your family during this lockdown, past lockdown?
Mm. I think us contracting COVID was not fun. Thankfully, we were all vaccinated at the time, so
Mhm.
the threat of severe health concerns wasn't as high, but being sick was kind of scary. Especially, I was scared for my parents, just wondering if their condition would worsen or,
Right.
but thankfully, it wasn't as bad as it could have been.
Yes, I'm so glad for that too. So next question. Do you feel your relationship with your family has changed since the pandemic? I know this is kind of covering what you already discussed about not getting close to your extended family.
Mm, I mean, it's 2 years' time. I think relationships can change just for the sake of 2 years' time. I don't know. So much has happened in that time. um, I don't know if my relationship has changed due to the pandemic, but yeah, I do feel our relationship has probably changed. Maybe how people reacted to it. Um, hearing their beliefs and values on why or why not, or why they're doing something or not doing something, learning their thought process might change the relationships in some ways.
Okay, I understand. So I know you have two younger brothers that live outside of your family home. So what was that like for all of you guys? Like how often did you get to see them or talk to them during the lockdown?
I think we talked probably as much as we did before, for sure. Um, and I think we probably saw my brother that lives in Austin as much as we could have as well. Um, he the circumstances of him visiting weren't necessarily different because of COVID. Um, we did, when we were sick, we did try to limit our contact with my brother that lives here to not um, infect him. But really, for the most part, not a whole lot changed.
Okay, well that's really good to hear. Um, So next, we are going to discuss questions that focus on your job as a parent educator at Easter Seals. So how long have you been working with Easter Seals?
I have been with the organization about 3.5 years.
Okay. And, as a parent educator, can you describe a regular workday prior to the pandemic?
Yeah, most of the time we would start our day at our main office in McAllen, and then we would plan out our sessions for the day, gather supplies, materials, and then be on the road for the most part. We would go home to home, taking toys, visiting with families, have lunch out on the field, and then end our day back at the office.
Okay. Can you please describe a general home visit prior to the pandemic?
Yes. So in a normal home visit, they're about 45 minutes to an hour, and we would take an activity that focuses on the area of development of the child or the prenatal mom. And it would be sometimes it would be a toy or an activity that we would leave there with the family so they could continue it. And then we would talk about some area of parenting, whether it's nutrition or discipline or health. And we'd have discussions around those things with the families. And then we'd either provide them with a resource for something in the community, something they're needing, or an event, or help them work on goals that are relevant for their family.
Okay. So what is it like working and helping these families that are assigned to you?
I enjoy it. I think it has a lot of benefits. It's nice to empower
Mhm.
people and help them see how they can help themselves, and offers a lot of, let's see, what's the word? I'm not sure, but really I enjoy the opportunity to help families potentially break cycles of abuse and neglect.
Right. Okay. And can you tell me a positive, memorable moment that you've had working with the family during the COVID-19 pandemic? And what made this a special moment?
Hmm. I really enjoyed when my families would send me pictures or videos of their kids at the same time, because during the pandemic, we would do a lot of virtual sessions. And really, I'm just getting a rectangular view of your life for 30 minutes, when opposed to I would go into the home and see everything. So when families would send pictures or videos of the kids doing an activity, or just whether it's crawling or accomplishing some skill that we were working on, it was always nice to see that.
That is sweet. And I know this change happened um, around the time Governor Greg Abbott declared that the coronavirus was a statewide public health disaster, March 13th, 2020. And so then by March 19th, he issued an executive order that limits social gatherings to 10 people. And is this around the time you were instructed to work from home?
It is, yeah.
Do you recall the day you were told that you would be working from home?
I don't have the exact date, no.
Uh, but like, how did it feel that day?
Oh, it was weird. We had, in the days leading up to this, we had been trying to social distance in our office amongst each other. We're wearing masks already, and just trying, it's hard to have a confidential conversation with the client when you're right next to your coworker who's trying to have a confidential conversation with their client. So we were spread around this office, and our supervisors gathered us in the main area and were basically said, okay, well, we're going to work from home, take your stuff. And we really had no idea how long it would be for, or if it was going to turn into like a hybrid situation, or what it would look like. But I do remember like us gathering and being told that we'd be working from home.
Okay, and so what were your first initial thoughts? I know you said that you weren't sure how long or if it would be hybrid. Did you have any other thoughts regarding this?
Excitement.
Mhm.
Excitement to work from home. There's a lot of comfort in being home. for safety reasons, for not having to drive reasons, for comfort reasons. There's a lot of benefits to being home. And that just sounded appealing at the time.
Mhm. Okay, so can you describe what a regular workday was like for you during the lockdown working from home?
I'll be honest, a regular workday was it's 7:55, my alarm goes off, and I open my work computer to start by 8. And that was a lot different than going into an office. And I would still see my clients at scheduled times, but where I had to make time for travel before, now I didn't have to. So I could see a client that lived in Mission, and not 10 minutes later, I could see a client that lived in Elsa because I didn't have to drive to their home. I could quickly just see them on Zoom if I had them planned. So to me, to me, it was a lot more effective.
Definitely. I mean, it sounds like it. So that's good. Um, okay, so I know you have been working on your master's degree. Can you tell us a little bit more about that and how you managed to juggle working from home as well as attending virtual classes during the COVID-19 pandemic?
Yes. So I actually started the program during the pandemic. There were a lot of incentives to students, including the GRE being waived. And there were a lot of like financial incentives as well for signing up. So I took the opportunity to join the program. And as far as classes with working, to me, it was very convenient. I was able, because classes were also virtual, I was able to close my work laptop at the end of the day at 5 o'clock and open my personal laptop and sign into class without any issues at all. I didn't have to drive to campus. I didn't have to pay for parking. I was able to do it pretty much with ease.
Well, that's really good to hear. I can see how all that was made your day work so seamlessly, not dealing with the commute and things like that.
It was a long day.
Oh, it does seem like a very long day, but it is nice not having to wait in traffic and things like that.
Yeah,
So I'm really glad that you've been working on that, and I know you've been doing such a good job.
thank you.
Um, so let's now talk about how this pandemic is affecting the work you do as a parent educator at Easter Seals. Can you share some troublesome moments that required you to navigate problems while working from home due to the COVID-19 pandemic?
Definitely. There are some of our clients who live in areas that don't have very good Wi-Fi. So that made it hard to do Zoom sessions. At the beginning, we had to kind of rely on phone calls, which, yeah, you can talk to somebody. They're just not as, what's the word? They're not sitting down and focused during that time. Plus, we're not able to see the child to be sure that they're okay, to be sure that things are going well in the home. So that was something that was challenging. And on a personal note, I am I am somebody who needs external motivation, and working from home requires a lot of internal
Mm.
motivation. So um, the ease of having my bed and the fridge and the TV within arm's reach was challenging to keep myself on task and motivated.
Okay. So, how did the COVID-19 pandemic alter the way you performed at work since you were no longer in the office and home visits were now limited to virtual visits? Um, and were you concerned about the effectiveness of working from home?
Initially, I was not concerned. A lot of my other peers don't have the same struggles that I do. They're very intrinsically motivated,
Mhm.
and they don't have the same struggles that I do to stay on task. So I didn't really think it was an issue. It wasn't until it became an issue with my productivity at work and brought up to me by supervisors that I was like, oh, you're right. And as far as effectiveness of working with families, remote home visits, I did have a little bit of concerns about not being able to physically see children to observe for abuse. No, that's not my job. My job is a parent educator, but that is something that we do look for. I am an extra set of eyes in that house, to advocate for children, and to not be able to see them or see what was going on physically on their body did kind of bother me a bit, but there wasn't a whole lot I could do.
Yes, very unfortunate. So can you share with me how COVID-19 has altered the lives of some of the families you would work with? For example, did you feel they had enough support and advisement from you and their community?
Sure. So I know a lot of our families, especially at the beginning, the families that have older children, they had to learn how to be a teacher to their kids through virtual school, and that was hard. That was especially hard because they're not trained teachers. They're not trained in technology, and if they have small babies in the house at the same time, plus me trying to schedule, it's very frustrating and very hard to do. I think for everybody, for the kids, for the parents as well. But as far as us providing or the families having enough support and advisement from their community, we did provide so many resources. I'm so thankful for a community that has so many resources for families, for testing sites, for vaccination sites, for free food services and how to access them. Um, so hopefully there was enough support for them here in the community.
That's really good to hear. Um, so did you have to educate families over the dangers of the pandemic and how they kept themselves and their children safe? If so, what did these conversations look like?
We did do some education about the dangers of the pandemic and how to keep their children safe, but a big chunk of the program is being respectful of family beliefs. So while we do talk about health education and vaccination, it really, we do have to honor a family's belief to vaccinate or not vaccinate. So what I focus more on is how to wash our hands properly and being safe when going out places, and at the time when it was mandated, wearing a mask if it's advised to do so.
Okay. So were any families worried about the pandemic and came to you to cover any new concerns that they hadn't been told about?
Uh, Families were definitely worried about the pandemic. They were subject to the same fear driven news sources that we were.
Mhm.
Plus like all the misinformation and social media um, exaggerations. So yes, there was a lot of concerns and that they shared about fear about taking their children out. A lot of people didn't take their children to parks or out to grocery stores or to the library or anywhere that their children might socialize.
Okay, I see. And did you have any parents who disagreed with the severity of COVID-19?
Not that they voiced to me.
Okay. Is there anything you wish you could have done differently regarding your profession, but was limited due to the COVID-19 pandemic? I know you already kind of stated that you wish you could have seen the children physically up in person. Is there anything else?
Um, Not really that I can think of. I think nobody has been through a pandemic before, so we are all just kind of doing our best, um, and moving forward. Hopefully, with this experience, we can make changes that will benefit everybody.
Okay. So I understand you are now working back in person in your office. So what was this transition like for you after working from home?
So we started off with a hybrid schedule where there would be 2 days in office and 3 days working from home, where we were still allowed to do some virtual visits and some in home with families that were comfortable. And now that we are, and so that was helpful in easing back into office life and waking up early and going in. And as far as being back in the office. I mean, I do miss the comforts of home. I miss the closeness of all those things I mentioned previously, but I don't hate it. I mean, it is kind of just the way it is. Um, I think a lot of my peers are struggling a lot. So it's kind of been a negative in work environment. But I mean, I think I'm handling the transition as best as possible.
Okay, is there anything new you've incorporated to your schedule to get used to this transition to adjust back into working from home at the office? I'm sorry.
Hmm. It's hard. I mean, it's just hard. I mean, like I mentioned, working from home alleviated some of the stress of scheduling and drive time, and it saved a lot of time. It allowed for more time to plan for our sessions and to do the required documentation. And I feel like now I'm having to remember to schedule based on location, and we're having conflicts with families not being available. So I feel a little stuck in that sense. So I could use some more helpful habits and practices.
Okay. Well, is there anything else you would like to add or share about the work you do at Easter Seals that should be mentioned for the sake of our future students, scholars, and people in general to best understand the lives of the families seeking guidance at Easter Seals?
Sure, I will just share that Easter Seals as an organization offers several different programs for families here in the community. The program I work for is HOPE, so it stands for Healthy Outcomes Through Prevention and Early Support. So we do have a focus on prevention. And so we use a curriculum called Parents as Teachers, where we believe that parents are the most important teachers in your child's life. So we do a lot of education for families that have exposure to abuse and neglect, and we just want to help them. We meet them where they're at. So no, we're not super happy that this thing happened, maybe a CPS case, but there's no judgment. We're going to just move forward and hope that it doesn't happen again. And we're going to learn through education. But we also offer programs like early childhood intervention, where they offer speech, occupational, and physical therapy to children 0 to 3. And they can, when the children age out at age 3, they will refer them to other organizations in our community that can provide those services that they need. And that's just a couple of the programs that Easter Seals provides here to those in the community. So if you are a student, it's a great place for internships. That's where I did my internship in undergrad. And for families, it's not income based. It is for truly anybody in the community who has children from 0 or prenatal all the way to 6 years old. So that's what I'll share about the organization.
Well, thank you so much for all this additional information about the organization. Um, so moving on to the last section, I'll be asking you to share any stories you have about the pandemic, and how you feel about the response by local, state, and national elected officials. Feel free to respond or pass on any of the questions.
Mhm.
So do you feel satisfied with the local response to COVID-19 in McAllen, Hidalgo County over the last 2 years?
I do. I feel like there was action taken as soon as information was passed down to us. I feel like, yeah, I do. I do.
Okay. Are you satisfied with the state response to COVID-19 led by Governor Abbott over these last couple of years?
Mm, satisfied, sure.
Okay, thank you. How do you feel about the national response to COVID-19 led by President Trump in the year 2020 and then President Biden from 2021 to present?
I would say satisfied. I mean, I think that if I can't say I know a whole lot about everything politically, I think there was some misinformation, but that's just present in our society. I
Mhm.
think there was misinformation about the severity of COVID. Um, that start no, I don't know if it started with President Trump, but he did perpetuate some of it. But he also did start initiatives towards a vaccine. So I think the continued push for research and having a vaccine available for those who wish to take it was the main goal. And I think that that was done effectively.
Okay. If you had the power of a political office to respond to COVID-19, what would you do differently?
Mm. Every day I'm glad I don't have the power of a political office. But I can't, I mean, that's so hard to say.
Mhm.
I think I might try to just remove myself and my ego from a situation and try and surround myself with people who know better than me. Just, you know, and that's what I mean by the ego, you know, just realizing I'm not a scientist. I don't have that background, and trying to surround myself with people who that is their expertise.
Very good answer. I liked it. So, next question. This is a special year in our national democracy because it's a midterm election voting year. Do you plan to vote? And if so, is the issue of COVID-19 going to factor into your votes?
I do plan on voting, but I'm unsure if the COVID-19 issue is going to be a factor for me.
Okay. Will you consider the national response to the COVID-19 pandemic in your vote for presidential candidates? I know that's kind of,
Sure. No, I understand the question. I think I will consider it. Will it be my most important point that I focus on? Absolutely not. But sure, I'll consider it.
okay. Last question. Is there anything else you would like to share with me about your experiences with COVID-19 that I have not asked about?
No, I think you've asked wonderful questions.
Well, thank you. You have provided great answers, truly. Um, so, thank you so much for taking this time to share your stories with me and the Voices of a Pandemic Oral History projects.
You're welcome.